to a special edition of Great Day Live. I'm Eric King alongside Claudia Coffey. You know, the holidays are a time of great celebration and happiness, but sometimes the holidays come with heartache. Many in our community are aware of the wonderful hospice care that we have, but today we're going to dive a little bit deeper and learn about other supportive care. We are here at Hosparus Health on Dutchman's Lane to address some of the heartache that we talked about.
Yeah, we're going to talk to so many of the professionals here about the importance of really talking through and allowing yourself to feel emotions both during and after the death of a loved one. We're also be joined by a very special guest, Jessica, whose son was a part of the Courageous Kids program. We'll talk more about that amazing program. And we're going to learn so much more about how to handle grief during the holidays.
As you know, Hosparus Health has been helping families navigate serious illness for more than 4 decades, but there are several services they provide to terminally ill patients at the end of life.
But what you might not know is that they provide help for patients months or even years through their palliative care brand. It's called Hosparus Health Partners. We're here now with Dr. Bethany Snyder and Tawanda Owsley to learn how families can access their supportive care sooner. Dr. Snyder, explain for people that may not be familiar, what is palliative care and then how is it different from hospice?
Thank you so much. So palliative care is a philosophy of care that's really focused on enhancing the quality of life for patients and families with chronic illness. What many people don't know is palliative, unlike hospice, should walk alongside people for years as they are diagnosed and they develop that illness and then it progresses over time. Hospice, as many of us know, is for 6 months or less with a terminal condition. So the beauty of palliative care is it allows us to come alongside patients and families, help improve their quality of life through symptom management, controlling their pain, wrapping them around with supportive services, and to ensure that they get the care that most closely matches their goals and what matters most to them.
And Tawanda, you have the awesome responsibility of leading fundraising efforts for Hosparus. It's important to mention that Hosparus Health is a not-for-profit. What does that mean for your patients?
Absolutely. Thank you for having us. As we talk about advancing and being innovative with our services like palliatives, we were able to support that through philanthropy. We raised about $950,000 to support the launch of this project. We take care of patients regardless of their ability to pay, and that's because of philanthropy.
And you've offered palliative care for quite some time. What was behind the decision to launch a separate brand?
So I think the beauty of Hosparus Health is it's been so well known in our communities for over 40 years, but that started to become a hindrance for new services and those expanded services. And so what we found is with this new and fresh brand that really spoke to a different type of support for longer for individuals with serious illness, that we saw immediate uptake and interest in that care delivery. And so we are honored and blessed by our Hosparus heritage, but we wanted to make sure our communities know we're much more than that, and we really want to support all facing serious illness, children to adult.
And Dr. Snyder, another question to you. What are the biggest benefits of palliative care, and who's a good candidate?
So palliative care's #1 benefit is to improve your quality of life. So think about having a serious illness and you've got debilitating pain or fatigue that keeps you from getting out of the home. Our team of experts comes alongside you, works with your providers to minimize the burden of that illness so you can create more moments with your family and with the people that you love. So anyone with a chronic illness such as lung disease, heart disease, cancer, neurologic conditions that's starting to feel that burden of the disease would be eligible for palliative care. And we see with early palliative care, people live longer and they have a better quality of life.
And Tawanda, let's talk about the donations. Why are they so important for programs like Hosparus Health?
Well, as we think about launching new areas of emphasis like palliative care, we need resources to do that. We were able to do that because of philanthropy and because of donations. Serious illness, you're in it for the long haul. It's a long time that families are impacted, and that requires and creates a financial burden for many families. We're able to relieve some of that stress. We're able to take care of the family, the entire family, in the comforts of their home often.
Well, now the big question, how can people help?
Oh, that's easy. You can visit our website at hosparus.org to make a donation. We are still accepting donations during this holiday time. Many families need your help. Many families are suffering right now. It's been a long year, almost 2 years, and we can rely on donations very much so.
Tawanda, Dr. Snyder, thank you both. Hosparus Health helps care for hundreds of children through their pediatric care program. Coming up, we'll meet the mother of a courageous kid named Jack.
Wherever you are, we are with you.